Is LDL cholesterol bad? Yes, but it depends on particle size. LDL particle count as a preference to volume. Next is high amounts of small, dense LDL. They increase cardiovascular disease risk by 3 to 4 times. That can be easily ordered on a blood test. Small, dense LDL is associated with metabolic syndrome, insulin resistance, diabetes, and obesity. And increased small, dense LDL values, they tend to increase or compound the problem of having too many LDL particles. And this is what's known as discordance. And that is where you can have a normal or slightly high bad cholesterol volume, but if you test and look at the size of the particles and find that the particles are numerous, then there's discordance and there is actually risk, even though the volume measures relatively normal. Next, is LDL cholesterol bad? Yes, but it also can be made worse if there's a lot of a protein called lipoprotein little a. Lipoprotein little a proteins attached to the LDL particle. In this picture here, the yellow is the LDL cholesterol characterized by its ApoB 100. That's the orange glob. That's the protein that characterizes LDL. And you see the squiggly line on the outer side of the LDL. That is lipoprotein little a. And lipoprotein little a makes LDL cholesterol a lot more damaging to our arteries beyond having high LDL level volume or count. Now, LP little a is highly correlated or associated with our genetics, and it tends to be a relatively stubborn value to decrease, and it is actually best lowered by means that lower LDL as a unit. Elevated VLDL, or very low density lipoprotein. This is a cholesterol particle that's typically part of a standard lipid panel, and it also imparts pretty important risk to cardiovascular disease. This carries a lot of triglycerides. It's a precursor ultimately to LDL. It tends to promote damage to the arteries. It tends to influence more smaller LDL particles, which are the more dangerous LDL cholesterol particles. And it also increases the risk of clotting as well. Elevated VLDL is not a good thing. Let's switch gears and discuss good cholesterol, or so-called good cholesterol, mostly good, or HDL, high density lipoproteins. Its benefits reverse cholesterol transport, meaning it's binding and picking up the cholesterol in the tissues in the periphery and transporting it to the liver to be metabolized. When it's functioning properly, it is active against inflammation. It promotes arterial dilation. It protects against the oxidation of LDL, which is a very bad thing. We never want our bad cholesterol particles to become oxidized. Additional good cholesterol, or HDL, benefits include providing immunity in the arterial system. So it helps to fight against pathogens, helps to keep viruses and other bad stuff out of our arteries. It protects our blood from being too sticky, so it decreases our risk of clotting. And low values of HDL are associated with higher risk of heart disease. HDL is most protective at a value of about 60. A 2 to 3% risk drop can occur with every increase in HDL. So good, healthy HDL values are important. Super high values tend to be non-functioning, though, and are not healthy. And I'll mention that a little more shortly. And high density lipoprotein cholesterol, or good cholesterol, is a good, yes, but it also depends on function. All cholesterol particles, LDL and HDL, good and bad, come in different sizes. And with HDL, we have small and we have large. The healthiest, best functioning HDL molecular particle is HDL2B. And it is the one that's most effective at binding larger amounts, carrying more LDL than other sizes of HDL particles to be metabolized. It can be most accurately measured by a apolipoprotein A value. That's more sensitive and more direct than an HDL value. High levels of HDL3, that's the poorly functioning ones, tend to be unhealthy. And occasionally an individual will have really high levels of HDL, 70, 80, 90, and that should be considered a red flag. It does not mean that there's a lot of protection inferred by that super high value. That tends to be poor functioning HDL. Beta blockers, the medications beta blockers and diuretics as classes, they tend to lower HDL values. So just like LDL or low density lipoprotein, HDL is healthy. However, it must be properly functioning in order to impart the benefits that good cholesterol is supposed to. With optimal LDL values, HDL function, HDL values are less important. So if someone has a good low LDL, then it does not impart a negative risk if their HDL is below 60 or even below 50. It tends to be less important. However, the flip side, the converse, is that having high LDL values makes HDL values within more important because they provide protection against elevated LDL. Triglycerides, these are essentially storage forms of fat. They do impart a true risk. That is a value that I encourage everyone to pay attention to on the lipid panel, not just LDL and HDL ratios. Those are important, but also looking at triglycerides. Triglycerides are highly closely associated with diet, essentially more sugar, more excessive carbohydrate, fried foods. Those are the foods that tend to be correlated with higher triglyceride values. They increase our risk of heart disease, of diabetes. And if you see an especially high value on a blood test, 250, 300 or more, that you cannot trust the accuracy of your LDL and your HDL testing. This module is available at courses, inlandnaturopathic.com, Heart Wellness courses, and the link to all of our courses are available at inlandnaturalmedicine.com.